I know it's a little bit different with Big Sky, but Rachel, can you share with us how you are helping your customers feel safe from when they enter your office through having a dental procedure? What steps are you implementing?
Absolutely. So much like we're doing with our staff, we're going to be taking our patients' temperatures as well and kind of going through the same question process. We start it when we confirm our appointments. So we kind of start that process on the phone, just so that they're aware. I think it makes them feel comfortable also that we're taking those extra steps. Then once they get to the office, before we even have them come in, we have kind of a foyer in front of our office. We're going to go through those same questions with them. We'll take their temperature, and then we can have them come into the office and kind of go through the same process that they would normally. We've removed chairs. We have about every other chair now in our office, so there's space. We're trying to definitely respect that social distancing in our practice, and also just trying to get our patients back quickly so they're not having to wait in the waiting room. We have no idea what it's going to look like when we open back up. Are patients going to come to their appointments? Are they going to be fearful? So we're really coming into this just being flexible to just see what that new normal means for our patients, and is what they once wanted, is that still what they want, or is that changing? So it's really going to be, this is going to be just a whole new normal for us. But once they come back into the office, typically our staff will come out and grab them without a mask on, shake their hand, really welcome them into the office. We're trying not, shaking hands really isn't something that I think anybody's doing right now, but still trying to welcome them in. We are going to have masks on when we go grab our patients. So it's hard because we do a lot of smiling and talking with people. And if you can't see someone's face, it's really difficult to see how they're feeling and welcome somebody without smiling. So that's going to be a big change, but really welcoming them back in and going through the same processes. Our inoperatory processes are pretty similar. The one main thing is that the doctors and the assistants and the hygienists are going to look a little different because we have more PPE that they're wearing, so more protective equipment that they're going to be wearing on a regular basis. So aside from that, I think it's going to be as similar as it was before, but just with some safeguards.
Thanks. So Becky, I know we aren't seeing customers yet in our office because of the phase, but what considerations have you guys talked about for when we do return and have customers actually seeing us in person?
Yeah, we definitely have a large client base that enters our office and a lot of partners within the community. So at the current time, we're saying during phase one, we're going to continue. What we feel is safest for the public as well is to continue our virtual meetings. We've learned how to do that very well in the last few weeks, and it's working well. And so we're going to continue serving clients virtually at this time. We've talked about phase two, reopening, and some of the considerations we'll make is where do they stand in relation to the front desk. We will set limits on the number of people that can be in our conference rooms, and we'll talk about at that time if we're ready to have, there's a lot of one-on-one counseling, but that usually requires people meet in smaller size rooms for that. We'll have to consider what's the best approach for that as well.